okay?
I don't know, it's hurting right here.
Oh no. I know most runners, they get shin splints from running downhill, and
it's like a sharp pain.
Really?
Yeah.
It's usually like you'll get pain here or on the outside, so I mean it's probably shin splints. And I do know like a really good shin doctor.
What is it called?
It's a crib clinic. Have you ever heard
clinic?
of it? Yeah.
No, kinda.
It's a really cool clinic. Like they'll help you help athletes and they'll nurse them back to health, doing different exercises and this and that. So like we should probably get over there.
Okay,
let's go to the crib.
Let's head over.
I got bad shins, that's my freaking problem. And yeah, I like to run downhill, that's my freaking problem. I got bad shins, that's my freaking problem. And yeah, I like to run downhill, that's my freaking problem. I got bad shins, that's my freaking problem. And yeah, I like to run downhill, that's my freaking problem. If you find somebody real with a freaking problem, bring your athletes to the crib, maybe we could solve them.
What?
Welcome to the crib clinic. Just kidding. What up, it's the crib clinic. Here we're going to talk about so many athletes come to me all the time with problems all the time. I don't know why. But here we're going to talk about the causes of shin splints. This is going to be the topic of everything. Runners, they get it all the time. I don't know why. But we're going to talk about how they're caused, how to prevent them. Come on, guys, let's prevent this from happening. I don't want it to happen. And exercises to strengthen them. You know, got to get some exercises in. And how to tape them. We got to look pretty with the tape. Keywords for you. This is pretty much why they're caused. We have bad running shoes. Number one, you want to always change out your running shoes because the tread, running so much mileage, your tread on the bottom of the shoe is going to wear down. You're going to have no support, no cushion left. So I suggest every 3 months, every 4 months, changing out your running shoes. Secondly, hard surfaces. Hard surfaces is one reason why you get shin splints as well, is because you are pounding on hard surfaces. You want to try and change it up. Run on grass, run on dirt. So you're not just going on the cement and pushing and working on not trying to run on hard surfaces. Then you have your form. The form is the foot placement. You don't want your foot to go heel-toe all the time. You want it to be mid-foot, right there. You want to land mid-foot. You don't want to land on your heel because that also just causes pressure, causes pain, poundage on your heels, which then, swells up your joints and it just works them to death. And you don't want that. Lastly, we have running downhill. Woo! Running downhill. That is exactly why most people get those the shin splints, is running downhill. Your mileage, people run lots of mileage. To run cross country, you don't need to have your mileage up to where you're running at least 70 a week. Mileage is a big factor. So 1, running shoes. 2, hard surfaces. 3, foot placement and form. And 4, running downhill. Come in.
Dr. Shin, I be having mad pain in my shins.
Oh, okay, well, come have a seat.
Oh, God.
Alright. Where do you feel the pain at?
Just right here in the inner,
To the medial
medial
side? Okay. Can you tell me a few things? What have you been doing? What do you feel causes it? Caused it from running?
Well, I was doing hill repeats, and all of a sudden when I was coming downhill, it just hurt right here.
Okay. Well, can I see your shoe real fast? Whoa, 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 whoa! Look at these shoes. We got holes. Your toes are peeking out. We've got some problems here already. Alright. Well, as you can see, she has good running form. And, you run mid-foot. But these are worn down. You need some new running shoes. So, for our key words, form, we're alright. Then we have bad running shoes. Bad running shoes, our #1 problem. We need some new ones. Alright, we're throwing those away.
Alright.
Also, you said you were running downhill?
Yep.
Alright, well, downhill does cause it. You were running on a soft surface, so I can give you some kudo points for that.
Thank you.
But have you been running on some hard surfaces lately?
Yeah, I like running on cement a lot.
You like running on cement a lot? Yeah, that is a problem. change it up, all right? Get some new running shoes. Come back to me when you have, some new running shoes, all right?
All right, thanks, Dr. Shin.
No problem. Dr. Shin in the house. See? Jackie Felix, our star cross-country runner, has came back with some new shoes, for one. And I'm just going to, teach her a few things, a few tips that she can do to help with her shin splints, and then also try to prevent them from happening. So, first off, I'm going to teach her how to tape her shins. So first thing we have is pre-wrap. So I'm going to wrap that along her shin. And then you want to make sure it's tight. You want to make sure it's up towards like the meaty part of her calf. High enough. So when it comes to taping shins, depending on where the pain is how you're going to tape. So she said her shin was on the inside, so the medial side. So what I'm going to do, I'm going to make sure when I tape that I'm going to come from the outside and I'm going to be pulling that back in, like the muscle. It's almost as if the muscle is detaching from the bone. Like you're going to pull that muscle right back onto, like attaching it back to the bone. So first off, we want to do is a low C, mid C, high C. So low C is angled downward, mid C is just like straight with a slight little angle, and then high C is going to be angled upward. So first off, I'm going to do my low C. I'm going to do another low C. I'm going to do a mid C now. You want to make sure you follow the tape where the tape wants to go. I learned that from the amazing professor that I had in my undergrad, Dr. Clover. He was.
Oh, you had Dr. Clover?
Yeah, he's pretty famous now. Yeah, so. All right, I'm going to do one more. No, now I'm going to be doing is my high C. Yep. Follow the tape where the tape wants to go. I almost had that when I was doing my master's program. And,
Ow, why'd you hit my shin?
Oh, well, once again, learned this through Dr. Clover, is when you do an amazing tape job like this, and it looks fabulous, you just want to smack it and be like, all right, fantastic shin taping job for shin splints. We also have other methods that you can do in order to, help treat someone who has shin splints. So what we would do is, you can ice it. Place the ice on your shins, always after like post-practice, not pre, but post-practice. After practice, you want to ice your shins. Another thing you can do is get, massage it yourself or have somebody else massage. Wherever the pain is, you want to get down in there and massage it. And that's pretty much a few tips that you can do after practice. So what are you going to do?
Ice, massage, and wrap.
Few exercises that you can do in order to strengthen your shins. So I'm going to have our athlete Jackie, she's going to be performing some of the things that we can do. So one thing you can do, they're called duck walks. So what you're going to do is you're going to get on your heels and you're going to kind of waddle like a duck. As you can see, she's on her heels, she's walking like a duck, looks like a duck, acts like a duck. She can quack like a duck.
No.
But, alright, so now we have the duck walks. You can do those. And then also, we have our ABC foot flexions. So, it's a fun way to, you can do this with your kids if you want. If you have kids, you can have them learn the alphabet as you're doing the alphabet flexion. So, what you do is you're just going to flex your foot, you're going to extend it, flex it, and you're going to be writing your name. You can do like, hey, alright, I'm going to write my name, Jackie. You're going to spell it J-A-C-K-Y. And you're just going to flex your foot with it.
My shins feel so much better.
You're welcome, anytime. And if you want, tell your coaches and other teams that we have the crib clinic here, and have them come, and I will fix those shins right up.
Yeah, I'm going to tell the whole world about the crib clinic.
Everyone should come to the crib clinic.